about the perils of creating a government plan on American families in health care. I'm very disappointed with the President and my friends on the other side of the aisle that they have chosen to pursue the creation of a new government-run plan, one of the most divisive issues in health care reform, rather than focusing on broad areas of compromise that can lead us towards bipartisan health care reform legislation. Yesterday, I spearheaded a letter with my Republican Finance Committee colleagues urging the President to strike a more conciliatory tone on health care reform. Having played a profound role in almost every major health care legislation for the last 3 decades, and having worked repetitively in a bipartisan manner with everyone from Senators Kennedy and Dodd to Congressman Waxman, I know something about getting things done for our families in a thoughtful manner. You advance legislation by focusing on areas of compromise, not strife. First and foremost, let me make this point again. Even though I am starting to sound like a broken record, reforming our health care system to ensure that every American has access to quality, affordable, and portable health care is not a Republican or Democrat issue. It is an American issue. When we are dealing with 1/6 of our economy, it is absolutely imperative that we address this challenge in a bipartisan manner. Anything less would be a huge disservice to our families and our nation. Clearly, health care spending continues to grow too fast. This year will mark the biggest ever one-year jump in health care's share of our GDP, a full percentage point to 17.6%. You can think of this as a horse race between costs and resources to cover these costs. The sad reality is that costs win year after year. Growing health care costs translate directly into higher coverage costs. Since the last decade, the cost of health coverage has increased by 120%, 3 times the growth of inflation and 4 times the growth of wages. It is not the only problem, but cost is one part of the reason why more than 45 million Americans do not have health insurance. I believe we need to do more to ensure that we achieve universal access to affordable and quality health care for every American. We can do this by reforming and improving the current system. However, the creation of a government plan is nothing more than a backdoor approach to a Washington-run health care system. At a time when major government programs like Medicare and Medicaid are already on a path to fiscal insolvency, creating a brand new government program will not only worsen our long-term financial outlook, but also negatively impact American families who enjoy the private coverage of their choice. To put this in perspective, as of this year, Medicare has a liability of almost $39 trillion. That's trillion dollars, which in turn translates into a financial burden of more than $300,000 per American family. In our current fiscal environment, where the government will have to borrow nearly 50 cents of every dollar it spends this year, exploding our deficit by almost $1.8 trillion, let's think hard about what we are doing to our country and our future generations. The impact of a new government-run program on families who currently have private insurance of their choice is also alarming. A recent Milliman study estimated that cost shifting from government taxpayers, specifically Medicare and Medicaid, already costs families with private insurance nearly $1,800 more each year. Creating another government-run government plan will further increase these costs on our families in Utah and across the country. Now, let me make a very important point. A new government plan is nothing more than a Trojan horse for a single-payer system, a one-size-fits-all government-mandated system where we're going to put bureaucrats between you and your doctors. Washington-run programs undermine market-based competition through their ability to impose price controls and shift costs to other purchasers. The nonpartisan Lewin Group have concluded that a government plan open to all and offering Medicare-level reimbursement rates would result in 119.1 million Americans losing their private coverage. This is almost 3 times the size of the entire Medicare program that's already in trouble. More importantly, this would run contrary to the President's own pledge to the American families about allowing them to keep the coverage of their choice. And so far as I know, no one has disputed the Lewin program. And they're well known as one of the most nonpartisan groups in the country. Proponents of this government plan seem to count on the efficiency of the federal government in delivering care for American families, since it is already doing such a great job with our banking and automobile industry. Medicare is a perfect example. It is on a path to fiscal meltdown, with Part A already facing bankruptcy within the next decade, and we all know it. It underpays doctors by 20% and hospitals by 30% compared to the private sector, forcing increasing number of providers to simply stop seeing our nation's seniors. According to the June 2008 MedPAC report, 9 out of 10 Medicare beneficiaries have to get additional benefits beyond their Medicare coverage. 9 out of 10 of them. We have a broken doctor payment system in Medicare that has to be fixed every year so seniors can continue to get care. This year alone, this broken formula calls for a more than 20% cut. I can keep going, but the point here is simple. Washington and a government-run plan is not the answer. Talk about creating problems. The supporters of the government plan, they know these facts, so they are trying a different approach by claiming that the government plan is simply competing with the private sector on a so-called level playing field. Give me a break. History has shown us that forcing free market plans to compete with these government-run programs always creates an unlevel playing field and dooms true competition. The Medicare program once again provides an important lesson. As a political compromise, Medicare was set up in 1965 to pay doctors and hospitals the same rates as the private sector. Faced with rising budget pressures, Congress quickly abandoned this level playing field approach and enacted price limits for doctors and hospitals. Today, as I've said, Medicare payments are 20% less for doctors and 30% less for hospitals compared to the private sector. Now, I have been told by doctors from Utah and across the country that if this continues, they will simply stop seeing patients altogether. A number of them are ready to quit the profession. I can't tell you the problems that will arise if we go to a government-run program, a Trojan horse to lead us to a government-mandated, government-run, one-size-fits-all massive program. In his March 2009 testimony before the House Energy and Commerce Committee, Doug Elmendorf, the director of the nonpartisan Congressional Budget Office, testified that it would be, quote, extremely difficult, unquote, to create, quote, a system where a public plan, government plan, if you will, could compete on a level playing field, unquote, against private coverage. The end result would be a federal government takeover of our health care system, taking decisions out of the hands of our doctors and our patients, placing them in the hands of a Washington bureaucracy and inserting that bureaucracy right between them. Here's the bottom line. We are walking down a path where stories like Jack Tag could become increasingly common in our great country. In 2006, Jack Tag, a former World War II pilot, suffered from a severe case of macular degeneration. The regional government bureaucrats rejected his request for treatment, citing high costs unless the disease hit his other eye also. It took 3 years to overturn that decision. 3 years while he had to suffer when we could have done this in a better way. Now let's just all remember that a family member with cancer in an intensive care unit would probably neither have the time nor the resources to appeal such an egregious bureaucratic decision. We need to remember the real implications of these policies, not simply in terms of political spin and special interests, but in terms of these policies' impact on real people who are our mothers, fathers, husbands, wives, brothers, sisters, and children. Just like the ill-conceived stimulus legislation and the flawed auto bailout plan, healthcare reform has the potential of simply becoming another example of the Democrats justifying the current economic turmoil to further expand the federal government. To enact true healthcare reform, we have to come together as one to write a reasonable and responsible bill for the American families who are faced with rising unemployment and out-of-control healthcare costs. I really do look forward to working together to transform our sick care system into a true healthcare system. I continue to hold deep hope in my heart that we will soon move beyond these Beltway games and work together in a bipartisan way to fix Main Street. The time is now, and I'm ready, and I'm absolutely positive that the way to go is not with a government-run, government-mandated health care program that will bring the lowest common denominator in health care to everybody. And not even everybody. I think you're going to find that the costs are so astronomical, the way it's being formed in the Health Committee in particular, that we're just leaving a burden on our kids and our grandkids and our great-grandkids that is going to be insurmountable. With that, Mr. President, I yield the floor.
President.